One of the wonderful things that Memorial Medical Centers provide is a nurse navigator. A nurse navigator meets with every patient that is hospitalized by our urology service, and she helps coordinate not only the inpatient care and testing, but make sure that the patient has the appropriate follow-up appointments. This provides great continuity of care for our patients, and it makes sure that no one gets lost in the process.
The nurse navigator role that Memorial was the first to introduce is a collaborative effort between the hospital and us, the physicians. In between is the patient, and the nurse navigator, her role is to help facilitate that communication between the patient that's in the hospital and with our office.
Hi, my name's Tia Raps. I'm the Urology Nurse Navigator here at Memorial. I've been a nurse for 20 years, and 10 of those years I've been in the urology specialty. As the Urology Nurse Navigator here at Memorial Medical Center, a large part of my role is to provide education and support to patients and their families. I want to ensure that anytime a patient comes in, I'm available to help them with any needs.
Tia knows a lot of what we do. She knows the procedures that we do. She knows the process of our care for patients, and she's able to assist in giving them some comfort.
Typically, I work with the medical residents and the attendings in collaborating with them on what the plan of care is for the patients. I make sure that I'm up to date on what the current treatment plan is, and I can be that liaison between that physician or resident and the patient and nurses on the floor.
Tia helps the transition between the patient being admitted to our floor to them going home. It helps with the education, filling in those gaps where the staff nurse may not know some of the home trials that the patient may have. Some patients have no needs, some patients have extensive needs, some patients need a lot of support once they leave our doors, and Tia helps bridge that gap.
Using nurse navigators is the wave of the future. It provides excellent patient care. Memorial's leading the way in providing these services, and soon you'll see all the other hospitals doing the same thing.
As a part of Memorial Urology Services, I work with your team to help ensure that you have great care. Your team is composed of your physician, the medical residents that work with those physicians, nurses, medical assistants and techs, the patient care facilitator, who actually is a unique role here at Memorial. They are kind of your gatekeepers for your daily care while you're here. Discharge planners, social workers, dietitians, and any other services you might need while you're here. We strive to ensure that you have the best care possible and want to make sure that you have the resources that you need to go home and live the healthiest life possible.